What's going on, guys? Welcome to another video on my channel, Hairliciously. If you guys are new to this channel, make sure to hit that subscribe button so that you guys are going to be updated on the latest hair loss topics, hair transplants, my minoxidil beard growth journey, and a bunch of stuff covering minoxidil with microneedling. So today I wanted to talk about a company that I've previously covered last year, and they are called Medipost. They are actually based out in South Korea and is a biotech company that is focused on developing cord blood derived from mesenchymal stem cell therapeutics, where their active ingredient is CM3. Now, the actual cosmetic product is called NGF-574H, and cord blood stem cells are exactly what they sound like. They are actually derived from umbilical cord blood. And just to kind of give you guys, I guess, Medipost some credibility, they are a pretty big company in South Korea. Based on my research, and they are actually one of the, if not the largest private umbilical cord blood bank. And they also have a product called Cardistem, which is also a stem cell based therapy on knee and hip cartilage regeneration, which was actually approved by the FDA 6 years ago. And they actually acquired patents in Europe to sell their product for treating cartilage, so they are actually a legit company. Now, this technology involves exposing mesenchymal stem cells, also known as MSC, acquired from cord blood to an artificially created catagen phase and developing a culture medium that can actually prevent hair loss. This also means that the stem cell liquid medium is actually not going to be the actual stem cell itself, but a medium that can actually be acquired during the process of culturing stem cells, and it's said to contain various effective growth factors that the stem cells have secreted. Medipost has created an environment which mimics the biology of hair loss for the stem cells to mingle, with which then instigates the stem cells to react and attempt to correct the situation by secreting factors which support hair growth. Now, up to date, Medipost actually has conducted 2 clinical trials with NGF-574H, with both of them being pretty successful. Their initial clinical results, despite the fact that it was only 4 months or 16 weeks, was nevertheless successful in the sense that its efficacy was comparable to minoxidil 2%. It turns out that CM3 had better efficacy at 16 weeks when compared with 48 weeks of minoxidil 2% treatment, and total hair count from baseline for CM3 was about 13.3, and the total hair count percent from baseline was 14.2%. Hair density also increased by 14.4%, and the hair diameter by 28.2%, compared to 12.7 for minoxidil and 8.8% for hair count percentage and also for hair density. So treatment with CM3 was actually 3 times faster than minoxidil 2%, but do notice this test was actually comparing minoxidil 2%. So for those who are wondering, minoxidil 5% at week 48 resulted in a little bit more hair growth. It actually resulted in a total hair count of about 19 from baseline. The other thing to kind of note is that the study was actually for 29 females and 1 male subject, which kind of bugs me since it was such a small trial with only 1 male subject, so obviously the results can definitely be skewed. But since male and female androgenetic alopecia is similar in terms of how they affect DHT, there is still a good possibility that this may be an effective and viable treatment for male pattern baldness. Medipost did also state that this is also going to be dose dependent, as with a lot of other drugs, which means that a higher concentration may have the potential to have better efficacy. The other good thing to note was that there was no penetration enhancing agents to achieve the numbers stated. And there was actually a rumor stating that the final product, once they do start commercializing, is going to have a penetration substance, which is going to increase the efficacy as well as increase the hair diameter and possibly result in more hair growth. Medipost conducted 2 clinical trials with NGF-574H, with both resulting in successful results. Since the prior test was mainly females, 29 females versus 1 male, there's actually another ongoing 6-month study with 90 participants on hair growth efficacy and the safety profile of NGF-574H in Asian adults suffering from genetic hair loss. But one thing that I did notice also in this study was that as far as the inclusion criteria, there had to be a minimum of 70 people who had to be females, leaving that at the most 20 males being studied, which is a bit ironic. And given the fact that the previous test only had 1 male subject, I was really hoping for at least 50% of the patients being males. Anyway, as far as the inclusion criteria, males would have to be between a Norwood 3 to a Norwood 4, so I'm guessing that a higher degree of balding may not work as efficient as those with moderate hair loss. And also their primary completion date is estimated at September to November of this year. So the good news is that a few weeks ago, Medipost did release information that their product NGF-574H is being turned over to a new company called Celeno. I don't know why they changed the name, but NGF-574H for hair growth was supposed to launch in Q1 of 2019, but apparently they were having some issues with mass production of the hair growth product's active ingredient, which caused a delay in the launch of the product in Korea. However, that issue seems to be resolved now, and word is that they should have it released into the market no later than July of 2019. So we still have, I guess, a couple months left to go. But the other thing is that clinics and hospitals are going to be getting their hands on this first. And as far as the pricing on this product, the CEO of Celeno said that it should be around the price of minoxidil. I'm guessing that it shouldn't be too expensive, but I also don't know if they're actually talking about minoxidil prices in the US where you can easily get generic, minoxidil for under $10 a bottle. But this is most likely going to be about Korean minoxidil, where retail price for their OEM manufacturer, but I would still say that, I guess if I were to kind of speculate, it costs anywhere from $50 to $80 USD. Maybe a little less, but that's, like I said, that's just my speculation. Now, this really does sound like a good alternative to those who do not respond well to minoxidil. And I really wonder how much better the results and the efficacy may be if used in conjunction with microneedling, because we do know that when it comes to minoxidil, if you guys were to use minoxidil with microneedling in conjunction of each other, you would see a lot more better results in terms of hair growth. But until then, we kind of have to wait and see on their upcoming results for their ongoing clinical trial. But I think of this as something more better than minoxidil without possibly the side effects and with even more better efficacy. If the progress and the improvements don't stop at 4 months, and if the 6-month study does show that its efficacy is better than the previous, then we might even have a winner. Now, cautiously optimistic, but let's wait and see what we get. Maybe I'll be able to even purchase it if they do release it by the time that I go to Korea in November for my second hair transplant. But as always, let me know what you guys think of this product. Leave me some comments so that we can get a discussion started. And before I go, one last thing is if you guys are looking for a proven method to regrow hair, look into microneedling or derma rolling with minoxidil 5%. There are multiple studies that show the efficacy of microneedling and minoxidil, which promotes hair growth, and you guys can read all about it on an article that I actually wrote on my website at HAIRLICIOUSLY.com. I'll leave it in the description box for those who want to take a look. Thanks for watching, guys. If you guys have any questions, make sure to shoot me an email or send me some comments, and I will talk to you guys next time. Take care.